Welcome to the HFMAtalk podcast, the podcast for NHS finance. I'm Alex Hunt, and today we're diving into some of the biggest news stories from the past month in the healthcare finance community. The NHS faces significant financial challenges this year, but on top of this, it has been asked to cut running costs and to focus more resources on the front line. This means redundancies at a time of major upheaval. To discuss all of this and more, I'm joined by Steve Brown, editor of the HFMA magazine, Healthcare Finance. So, Steve, summer is traditionally a little quieter in NHS finance circles, with Parliament in recess, and so there is usually a reduction in the policy statements and government demands placed on the service, and an opportunity for finance professionals to get a summer break. But it doesn't feel like that this year, does it?
No, that's right, Alex. The government's 10-year plan has created a huge agenda for the whole service, with finance professionals having a major role to play in the proposed transformation of services. That 10-year plan relies on being able to lay some stable financial foundations. There are really challenging proposals to return all organisations to financial balance over the next 3 years. That doesn't just mean the NHS as a whole breaking even, balancing deficits out in one place with underspends elsewhere. It means getting every organisation into a balanced position. As part of this, the government has promised to accelerate the move to fair share allocations so that areas actually get the resources suggested by the detailed allocation formula. And it's promised to phase out deficit support, meaning that different organisations' financial positions will be far more transparent.
So, what is the starting point for this then?
Okay, the starting point, and these are really big ambitions, is delivering a balanced position at the system level this year. That didn't seem too likely at the start of the year, with Integrated Care Board's first draft financial plan suggesting a deficit for the year of £6.7 billion. ICBs were told that this was not acceptable, and after much hard work, final plans, which still rely on some £2.2 billion of deficit support at this point, were developed that target a balanced position. And at the end of Q1, that's the end of June, systems were reporting a 78 million overspend against this plan, which was broadly considered to be on plan, although there is recognition that there are lots of risks to maintaining the financial position and a huge reliance on savings being delivered in the rest of the year. If that wasn't enough to keep teams occupied, there's also been the very specific demand for systems to reduce their running costs. There are different requirements for ICBs and providers. ICBs were initially tasked with reducing their running costs by 50%, although this has subsequently been translated into a ceiling of £19 per head of weighted capitation. Providers have been told to reduce the growth in their corporate costs since before the pandemic by 50%, and all this alongside proposals to abolish NHS England, with the subsequent merger with the Department of Health and Social Care, again enabling a 50% reduction in headcount across the two bodies.
I guess the running cost reductions add an extra layer of challenge to what is already a huge financial ask this year, and that has been further compromised by the resident doctors' strike action in July, which will have a financial as well as service consequences, and there's no guarantee that the NHS has seen the last of industrial action this year from various staff groups. But for now, let's focus on those running cost reductions, and in particular, the demands being placed on ICBs.
Okay, so ICBs have submitted their plans for cutting costs. There was a big range in running costs per head across the 42 ICBs, with some of the differences related to the size of the board and the population covered. And as a result, a number of boards are coming together in clusters to realise better economies of scale. The end result will be that we have 26 ICBs, including those newly clustered boards. But there will still need to be significant reductions in staff. ICBs are moving towards becoming more strategic commissioners and will need to grow certain activities, for example, around population health management, while shedding other responsibilities, such as the oversight of provider performance. So their staffing levels need to take account of this change in responsibilities. But at the end of the day, to deliver the cuts, ICBs will need to make some staff redundant, with different levels of cuts needed depending on the ICB's starting point. Some are close to the £19 target, others are way above it. This will not be a cheap process. Greater Manchester ICB has estimated that shedding up to 400 staff could cost it up to £42 million in redundancy costs, based on various assumptions on seniority of the staff being let go and how long they've worked for the NHS. In Manchester's case, it estimates that the savings delivered by these cuts will mean that the redundancy programme's costs will be recovered in 17 months. In other cases, there may be payback within a year. But the fact that this restructuring could be delivering absolute savings within a reasonable time frame doesn't help with the problem right now.
The NHS Finance Event of the Year is back. The HFMA annual conference returns to London this December, bringing NHS finance professionals from across the UK together for 3 days of insight, collaboration and networking. Expect inspiring keynotes from healthcare leaders, engaging panel discussions, and the chance to connect with colleagues to discuss shared challenges and to celebrate the best of NHS finance. Standard ticket rates are now available. Book now to get tickets to the biggest HFMA event of the year. Visit the link in our show notes to find out more and to book. Now, back to the episode.
In total, across the country, some estimates put the cost of ICB redundancies at about £1 billion. Remember those difficult financial plans we talked about? ICB's reworking plans to deliver a balanced position, underpinned by £2.2 billion of deficit support. While ICBs are broadly on plan to deliver this position, they simply can't continue to hit those plans if they have to take a further £1 billion hit.
Okay, so what are the options for resolving this? What are we talking about?
Something has to give. There's no contingency for this within the NHS England budget. So either the government provides additional funding, which is understandably difficult in the current climate, especially when the NHS is already one of the key winners in its spending review, or it accepts that NHS ICBs can't hit their financial plans. And it's clear that that is not acceptable. Or it amends the timetable by which the running cost reductions have to be made. And it's probably already too late to hit that Q3 deadline given the need for consultation with staff. ICBs have worked up redundancy plans on the basis that they will be centrally funded, given the restructuring requirements were announced after they had submitted their financial plans for the year. NHS England Chief Executive Jim Mackey last week told the Commons Health and Social Care Committee that NHS England had never said there was a guaranteed pot of money for redundancy programmes. However, NHS England remains in detailed discussions with the Treasury, and Sir James told the committee he was confident of finding a solution across the spending review process. It's not completely clear what that means, although he added that there are a couple of paths depending on different scenarios. Whether that means funding or delays to the timetable, or a combination of the two, we don't know. However, in a subsequent meeting with another Commons committee later in the week, Sir James expanded on his earlier comments. He acknowledged that the initial plans were for a, quote, dramatic, speedy change process, unquote. That would have incurred big upfront redundancy costs. This remains on the table, but if funding can't be agreed with Treasury, then Sir James says that there have been discussions with ICBs about doing it over a longer time period in a more managed way. He says this is possible, but stresses that it will not deliver the pace or scale of change needed to deliver the operational imperatives. NHS England says it hopes to provide more clarity within 2 to 3 weeks, and there's recognition that NHS England will need to be flexible on timing, depending on the detail of any resolution.
This is about more than just money though, right? This can't be easy for staff working in ICBs.
This is undeniably a real financial headache, but we can't forget the massive human impact this change will have. If the 50% cut in running costs means halving the ICB workforce, this will involve 12,500 staff. And while all these discussions are going on about how the necessary redundancy programmes will be funded, ICB staff are left worrying about their futures. Sir James acknowledged the stress ICB staff are under, while also facing a major agenda in preparing for their board's new roles as strategic commissioners. He acknowledged that this was not fair or right, which is why the issue needs to be resolved as quickly as possible. That resolution can't come quickly enough, enabling ICBs to get properly started on their restructuring programmes and giving staff more certainty about their own positions. It's a case of all eyes on NHS England.
Steve, thank you for joining us this week to break down the big news stories shaping NHS finance. As mentioned, Steve is the editor of Healthcare Finance, the official magazine of the HFMA. The magazine provides in-depth coverage of the financial challenges and developments affecting the NHS and the wider healthcare sector, offering expert analysis, insights, and best practices for finance professionals. For more news, articles, and blogs from the editorial team, visit the HFMA website to stay up to date with everything happening in healthcare finance. That's it for this week's episode of HFMA Talk. Thanks for listening, and we'll see you next time.